Good day, my name is Gabrielle Swan, and I will be presenting the Health Communication Campaign for Metabolic Syndrome in Black Women. This is an overview of my presentation. According to the Centers of Disease Control and Prevention, the leading cause of death is heart disease. Therefore, it is important to prevent conditions that can precipitate heart disease, such as metabolic syndrome. Metabolic syndrome is considered a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. There are 5 criteria according to the National Cholesterol Education Program Adult Treatment Panel 3, which include waist circumference greater than or equal to 102 centimeters in males and greater than or equal to 88 centimeters in females. A serum triglycerides greater than or equal to 150 milligrams per deciliter or treatment for elevated triglycerides. A serum high-density lipoprotein cholesterol less than 40 milligrams per deciliter in males and less than 50 milligrams per deciliter in females, or a treatment for low HDL. Blood pressure greater than or equal to 130/85, or a treatment for hypertension. Fasting plasma glucose greater than or equal to 100 milligrams per deciliter, or previously diagnosed type 2 diabetes. The population for this study is Black women. Leading cause of death is heart disease, higher risk of dying from heart disease at a younger age than white women. Non-Hispanic Black women were more likely than non-Hispanic white women to have metabolic syndrome. The goals of this campaign include awareness about metabolic syndrome, as many persons may have heard and have a vague understanding of the different components of metabolic syndrome, however, may not understand that a combination of the criteria can increase risk for heart disease and stroke. The other goal for the campaign is to communicate the need for aggressive lifestyle modifications via weight reduction and increased physical activity. The campaign strategy must enhance knowledge on metabolic syndrome and encourage lifestyle modifications. The behavioral health theory that will be utilized is the social cognitive theory, which suggests that the social environment is a central influence on behavior, making personal characteristics alone an inadequate explanation of health behaviors. The SCT contains 5 constructs, which include knowledge, perceived self-efficacy, outcome expectations, goal formation, and social structural factors. To create awareness, the campaign will enhance their knowledge via commercials or video shorts, pamphlets that will be distributed to hair salons, doctors' offices, food stores, or farmers markets. It will also be featured on a campaign web page with information on metabolic syndrome and prevention techniques and resources. Also, to encourage lifestyle modifications, the campaign will seek to increase self-efficacy via verbal persuasion and vicarious experience via commercials and social media video shorts on platforms such as Instagram and YouTube. The evaluation for the health communication campaign will include the initial evaluation, process evaluation, and outcome evaluation. The initial evaluation will take place prior to the implementation of the campaign strategy. The initial evaluation will include quantitative and qualitative study with a focus group that includes an experimental group of Black women of varying ages and weight classes versus a control group of different ethnicities with varying weight classes. The goal of this study will be to evaluate the sample interventions prior to implementation. During the implementation phase, a process evaluation can be conducted using an audience tracking survey with the goal of monitoring campaign reach, message fidelity, and audience engagement. And lastly, the outcome evaluation will be a longitudinal cohort study with the goal of providing information for future campaigns. These are my references. This is a mock-up script of the video short. Thank you.